Okay, so let's go ahead and get started with today's presentation. Again, this is the Partnering with Schools for Mental Health Leaders webinar series. We are funded through SAMHSA, Substance Abuse and Mental Health Services Administration. And we are part of SAMHSA's Technology Transfer Centers. I work for the South-Southwest Mental Health Technology Transfer Center. And all of our centers are part of SAMHSA's network of regional centers, which were designed to provide regional technical assistance to organizations with the Mental Health Technology Transfer Centers and the Serious Mental Illness Advisor Service being recent additions to this network. These regional centers are spread across the United States and include Puerto Rico. Our region here, the South-Southwest, is Region 6, which includes Texas and the surrounding 4 states, Arkansas, Louisiana, New Mexico, and Oklahoma. The purpose of the Technology Transfer Centers is to develop and strengthen the behavioral health care and primary health care workforce in their work as it relates to substance use disorder and mental health disorder prevention, treatment, and recovery support services. We help people and organizations incorporate effective practices or evidence-based programs into substance use disorder and mental health disorder prevention, treatment, and recovery. It's basically a research to practice model, if you've heard that expression before. We like to know that something works, and we like to move that into the organizations. Okay, this is the TTC umbrella from SAMHSA, excuse me. And underneath it, you'll see each of our technology transfer centers. There's the addiction TTC, the mental health TTC, the prevention TTC, and then the SMI advisor. The SMI advisor provides individual consulting with clinicians who are serving people with serious mental illness. Okay, so today's webinar is on understanding school culture, and we have 2 guest speakers with us today that we're very excited to have. Thresa Caldwell is the Behavior and Mental Health Coordinator at Goose Creek Consolidated ISD, and Denise Magallanez is the Manager, Division of Review and Support in Special Education at the Texas Education Agency. And I have a little bit to read about each of our speakers today, and then we'll get started with their presentation. Thresa Caldwell is, like I said, the Behavior and Mental Health Coordinator at Goose Creek. She earned her undergraduate degree in Applied Arts and Sciences with an emphasis in social work and a graduate degree in community counseling from Stephen F. Austin State University. Thresa is licensed with the state of Texas as a licensed bachelor social worker with a specialty recognition and independent practice recognition. Her license to practice as a social worker in Texas was issued in 1995, and she has practiced continually since then in various capacities. Combining a sense of entrepreneurship with a social work and counseling background, Thresa founded Family Network of East Texas in 2000, which provides comprehensive services to families involved with Texas Department of Child and Protective Services. Other practice areas of social work include 2 years in a hospital setting and 18 in the educational setting as a school social worker. Thresa has filled requirements to become certified and instruct several crisis interventions and suicide prevention models. One currently utilized most in the school and community setting is the facilitation of youth mental health first aid training. Theresa's education and career have always focused on her passion for working with and providing encouragement and comfort to children and families. And we're so happy to have her with us. Dr. Denise Magallanez is an educator with 18 years of experience in education, working primarily with culturally and linguistically diverse students from all grade levels in the Rio Grande Valley. Her vast experience includes serving students with disabilities, those considered at risk, and students from economically disadvantaged backgrounds and their families. Denise has served students as a classroom teacher, campus administrator, district administrator, SEA technical assistance specialist, and is currently a manager in special education. As a campus and district administrator, she was integral in creating and implementing inclusive instructional practices that ensured positive academic and behavioral outcomes for students with disabilities. Denise earned her Bachelor of Arts in Interdisciplinary Studies, cum laude, and Master of Education in Educational Leadership from the University of Texas, Brownsville, and PhD in Leadership Studies at Our Lady of Lake University. Her research was titled Exploring the Relationship Between Authentic Leadership and Job Satisfaction of Special Education Educators in Texas. As a member of the Texas Education Agency, Denise collaborated with the Texas Behavior Support Network, analyzed research in positive behavior support, culture and equity and discipline and trauma-informed care, and connected across state agencies and stakeholders to seek input and formulate initiatives to address the needs of our students' behavior. Denise is currently working on the redesign of special education monitoring in the Division of Review and Support at the Texas Education Agency. And with that, I am going to let Denise lead us in understanding school culture. Go ahead, Denise.
Do you want me to lead or do you want Denise to lead?
Thresa, I'm sorry, Thresa. I do that every time. Thresa Caldwell.
All right. Thank you, Michelle. And I'm so honored to be able to briefly share a little bit about understanding school culture. Of course, school culture is one of the most complex and important concepts in education. The term school culture generally refers to the beliefs, the perceptions, the relationships, attitudes that shape and influence every aspect of how a school functions and operates, largely shaped by the school's history, of the community in which the school is located, the administrators, the school staff, students, parents, and all of the community all contribute to the school culture. In other words, school culture is basically the way schools do things. As schools began to collaborative efforts with community mental health providers, understanding the culture of the school will be paramount to the success of the partnerships. And on your slide, you will see a few of the agencies that Goose Creek is currently partnering with. We have our Harris Health System, DePelchin Children's Services, Save the Children, and NAMI. Linking the mental health services through schools is an effective approach because that's where schools are. So there has been an overwhelming encouragement for school districts and local mental health systems to partner to ensure that children with mental health needs have improved access needs to those services. Such access leads to early intervention and support, which have been proven to result in better school, family, and community outcomes for children and with emotional and behavior issues. Most children, like I said before, because that's where students are, they're at least at school for 6 hours of the day, which makes it an ideal place to provide mental health services. One of the biggest challenges facing adolescents and children who need mental health services has been gaining access to the health providers. Typically those appointments, if they are after school, it makes it rather difficult for parents to take off work and then take those children to school. Therefore, having the services there increases the odds of those children being able to utilize those services. Research clearly states that access to mental health supports has an enormous impact on school improvement. Partnerships that address the mental health and developmental needs of children is one of the key strategies for improving the learning environment and academic performance. It is also well documented that early intervention and treatment will reduce the risk that children will end up in the juvenile justice system or any other child servant system, improving the odds that they will grow into productive adults. Other benefits of education and mental health partnerships, again, will be the improved academic outcome. It also will increase the odds that the school staff will be better prepared to address the students' mental health needs. And then, of course, some of the impacts of the community from the community provider would be being able to facilitate early identification by providing us appropriate screenings, assessments, and then follow-up right there on the campus. Improved efficiency and coordination of services among the school staff. One of the things that we have noticed that with the partnerships that we currently have is that our community provider is able to then inform or educate the staff as it relates to mental health awareness. And one of the main key things that we're wanting to do by having the partnerships is to reduce the stigma associated with the mental health treatment. And that is really good by having the clinics or the providers there on staff because it's right there where the students are located. So I've addressed the need for access to the students and how it impacts education and mental health partners. So how and where do we begin? Again, as I stated, schools are complex systems, and they're also complex to join in. Schools and community-based providers need to enter into a partnership with a clear understanding of each other's strengths, their needs, and their culture. This includes understanding how to get started, appropriate services, the rules to understand, and issues for partners to address to prevent problems from emerging as the two different systems and cultures interface to better serve children and their families. One of the first things that has to be key is setting a clear vision and goals. Successful partnerships share a common vision in which to carry out their goals and objectives. The use of a school-wide needs assessment to determine what current services can be leveraged and where the gaps are. That is going to, again, you're setting that clear vision and the goals for that partnership. You need to also have a clearly defined purpose of the collaboration. What is the purpose? When we're looking at combining the schools and a community health providers or those agencies, we're looking at how both parties can benefit from that collaborative, that collaborative effort. Also, you need to maintain a formal style of open communication, and that just means that there is ongoing communication between the two parties. And one of the things that has to make sure that is in place is that all of the key stakeholders are brought to the table in the initial meeting. And that way, everyone understands how everything is going to be provided, the rules, every facet of the partnership. We also need to make sure that we recognize and respect the differences between the two cultures. And when you're looking at setting up that initial meeting, you want to be able to understand and discuss the different philosophies, the roles of the provider, the roles of those that are employed by the school district, and sometimes how they may seem like they would overlap, but also setting up and recognizing that there is a specific role for everyone included. You also need to discuss the confidentiality rules. And this would be an excellent time to talk about HIPAA versus FERPA. There must be mutual commitment for the long-term stability of the partnerships. It is important that both parties understand their commitment to the partnership and how to sustain that partnership. And of course, there has to be an evaluation of the program's progress and effectiveness. And that it's imperative that the services and the relationships are continuously monitored to help maintain that focus and accountability, and also to improve the outcome of the partnership. And last but not least on this slide is problem-solving processes. It is going to be key that there is a process in place that should and when issues arise, that there is a way to address those issues. And then also not only knowing how to address those issues, but who to communicate with. Who are the key players that will be sitting at the table as you move into this partnership? The key roles in school systems. In order to fully understand how school districts and community-based providers can effectively partner, the key responsibilities of each staff member and the community mental health clinician must be clear. Partners are encouraged to fully discuss the roles and the responsibilities to avoid potential conflicts. You have your local school board, who is basically an elected committee that has the control and the decision-making decisions for the local schools or the community. You have your superintendent, who is the liaison between the school board and the school district itself. The school superintendent basically is our district leader. He or she is the one who will typically manage or oversee the finances of the school district. They lobby for the district, and then they also oversees the daily operations of the entire district. You have your campus principal, and your campus principal is responsible for administering the total operation of the school. Their responsibilities also include supervision of staff members, supervision of the instruction, the curriculum development. And as we discuss our campus principal, and as we understand in the culture of the schools, our community partners will need to understand that your campus principal will be the key person to make sure that the partnership is effective. And then you have your campus assistant principal, and typically their role is disciplinary issues, and then also dealing with attendance. And this may not be the same at all campuses in all districts, but I'm speaking to what we have, what I've witnessed in Goose Creek. And basically, the assistant principal also could be responsible for the day-to-day operations of the use of the facilities or the building. And then also, they are typically the ones who will meet with the parents whenever there is a issue with that student or their child. Your school counselor. Your school counselor will focus on helping students address their academic, personal, social, and career development goals and their needs by designing and implementing a comprehensive school counseling program that promotes and enhances student success. Some schools may have a school social worker, some may not, but if you have a social worker, your social worker is going to be your advocate for the students. Their training includes specialized preparation in cultural diversity, systems theory, social justice, risk assessment, intervention, consultation, and collaboration. And also your social workers will provide intervention strategies to address the mental health needs of our students. You also might have a school psychologist. The school psychologists specialize in analyzing complex student and school problems and selecting and implementing appropriate evidence-based interventions to improve the outcomes both at home and at school. Your school nurse will be responsible for providing a comprehensive health services in addition to possibly nutrition services. Then, of course, you have your teachers that are responsible for providing instruction. And then you may have some contractual staff that is responsible for other key roles that have been identified as needed. And I want to take you back to the principal. Principals, again, as I stated, they have the power and the influence to sink or swim initiatives. When they are convinced of the value of the partnership, they can take steps to secure the active participation of the school staff and the community partners, thereby greatly increasing the partnership's chances for success. And just some of the key issues or key things to remember when you are dealing with the principal. Remember that the principal is responsible for the success of the entire school. Also, another key thing is to remember that the partnership must help facilitate the goal that every student receives an appropriate education. And another key thing is to remember whenever you're visiting with the principal, most of them, their constraints on their time will be very limited. So your meetings with them will need to be brief and solution focused. And so those are some key things to remember when you're addressing meeting with the principal. So I've shared with you some of the things as it relates to the culture of the schools and understanding the culture. And then also I touched a little bit on some of the collaborative, the partners that Goose Creek has. So I wanted to share with you some of the things, the efforts that we've initiated in Goose Creek. One of the biggest things that I have been really proud of is the initiation of our bus field trips. And our bus means bridging unmet supports. And this is basically where the support staff, which includes the counselors, the social workers, our behavior specialists, our LSSPs, our communities and schools, our community youth specialists who are contracted workers through Harris County. We all come together on our POC days. And those are the holidays where the students are out, but of course the staff members are working. And what we've done is that we've taken our list, our community resource list that we pass out or give out to the parents, and we've started making agency visits. And that is for twofold. One of the things that we wanted to make sure is that as a professional, referring parents to some of the agencies that are typically listed or in all of our communities, we wanted to make sure that we had a better understanding of the services that they provided for our students. And then also we wanted to make sure or have an inside contact person. So when we are referring parents or when we're talking to parents and we're giving them our resource list, and we can say, we've actually visited this facility and here is the name of a contact person should you desire or choose to utilize this agency's service. All of these field trips is typically a full day where we take our staff and we actually load up on the bus, our school bus, and we go to these agencies that we have chosen. Our first trip that we do in the typically the very first trip into the new school year, we call it our Baytown road trip. And because we are located in Baytown, we actually utilize the Harris County Transit bus. So that's the only trip that we do not take on our school bus, but we actually get on a transit bus that has been reserved for our staff. And we go to all of the agencies that are within our community. Because we are 20 minutes from Houston, the remainder of those trips for the school year is typically in the Houston area. But we wanted to make sure that we understood and highlighted our community services that are right here in our city, as well as those that the parents may have to drive a little bit into the neighboring community. So that is, and of course on our slide, you see our upcoming itinerary for the upcoming school year. One of the other initiatives that we started 2 years ago was our Engaging Parents in Education series. And this initiative is with our community partner, NAMI. And basically what we do is we have a series of parent meetings. And those parent meetings are geared towards those parents who has had a student to be identified with a mental health diagnosis, or some of our students who have had a crisis risk evaluation. And so what we're doing is we're trying to put the information from NAMI within the school districts where the parents have easy access to come into the meetings. And typically what we do is it's a 1-hour meeting that we invite NAMI as well as some of the other agencies, but NAMI is typically will be the presenting agency to come out and actually do the parent series. We've had great success with having this education series for the parents. And the ways that we typically advertise it is that we send out an email to the parents, and we also utilize our call out system. So on the day or a couple of days before the event, all of the parents within the district will receive a phone call reminding them that this class is coming up. And so we've had great success with this. And so this is just one of the things that I wanted to share with you. As a recent recipient of the Rebuild Texas grant, what we have done is we've invited other partners to come in as well. And the way that we did this, the Rebuild Texas grant, basically is to bring those providers from those community partners within the school. And the way that we were able to determine which agencies were participants is that a needs assessment was completed. And based on the needs of the 10 different campuses within Goose Creek, What we did is we had what we called a vendor meeting or vendor presentation, where we invited all of the vendors to come together. And what they did is each vendor had 13 minutes to give an overview of the services that their agency provides, and then also a question and answer session. And basically this meeting was held with our campus principals or a designee from that particular campus. And at the same time, in the adjoining classroom, we had all of the community agencies to come together for a taste of Goose Creek. And basically it gave them a networking opportunity to meet and greet with one another and discuss their agency and how they will be partnering with our school district. So we're really excited about how all of this is going to come together for this upcoming school year. And these are just a small example of some of the partners or the relationships that we will be entering into for this school year.
Thank you very much. Denise Magallanez, are you there?
Am I unmuted?
Oh, there you are.
Okay, you can hear me.
Yes.
Everyone, how are you? Do I have control?
Yes, you do.
Okay, perfect. So my name is Denise Magallanez. I'm currently working for the Texas Education Agency, as Michelle expressed. And so thank you, Thresa, for your beautiful presentation. I'm going to go based on my experience. I want to give the caveat to the audience so that they understand that I'm not currently at a campus nor at a district at this point. I do have an extensive amount of experience at the district and campus level. So I'm really excited to share this information and represent the area where I've gotten all of my experience from. So as you can see, that's South Texas and also rural schools, which I understand that across the state, working at the state agency is a huge issue and concern that we have trying to access the resources. So I really thought it was important to share this information with you all. So just to give a brief overview of South Texas, what I'll be covering today is the universal design of the school culture, the diverse needs and the demographics of the students in South Texas, the comprehensive framework that most districts, most LEAs, those are local education agencies across the state, incorporate in order to meet the needs, academic and behavioral needs of their students. Trauma-informed care practices that in South Texas we see a lot. The collaborative efforts that we have joined in with agencies across the area in the mental health area, and then as well as just covering a little bit of the Texas monitoring and the technical assistance that we are redesigning for the state of Texas. Into the universal design of school culture, I wanted to begin by reviewing what the local education agency structure is that I identify as LEAs. So the LEA structure in South Texas is comprised of the same components of Goose Creek. So to add to the differentiation of charter schools across the state, they're made of the same individuals that they have, and in charter schools, they have what is called board of directors in lieu of school boards. Given the various sizes of the LEAs in the region, roles may serve a dual purpose, if not more. My background consists of being a campus and district administrator at one of the largest LEAs in south of San Antonio, as well as a rural community. And so I wanted to give you just an example of what my day-to-day operations, what I oversaw. So in one of the areas, obviously the largest LEA, at the campus level, I was a specialized campus administrator for special education and Section 504. So that's a large urban area that you will find various roles, behavior specialists, school counselors, guidance counselors, assistant principals, testing coordinators, principals, associate principals, and then various roles across the district and their department and individual departments. In the second one, in the rural community, I was a dean of instruction, also testing coordinator, administrator for special education, administrator for LPAC, which is the language proficient I forgot what the A stands, but we went ahead and we worked. That's the specific committee that works with identifying students' needs for bilingual education in ESL. And then I oversaw academic areas as well as accountability. Those are two specific areas that I worked on in regards to my experience. So as we're thinking about what the school culture consists of, it is extremely important to understand that in your rural areas, you're going to have individuals that wear many hats. You're gonna go to one person, and they're going to be the testing coordinator, the dean of instruction. They're going to be that person that you go to for a lot. In your larger urban LEAs, you may go to one person in one school and then have to go to another person in the other. So those are just an example of some of the different elements that you'll find at the campus. The connection we had in all areas was Texas Tropical Behavioral Health. And so most of the time, as like a former campus assistant principal, the charge was to identify, how we could make those connections for supports. Sometimes facilities was an issue with identifying how to provide those services when an outside agency would come in to support our students. And so really that's going to depend on the size of your student enrollment. If a campus is really large or they don't have enough room and they have large classrooms, the students inside the classrooms, you're going to find some challenges to identify places to provide services from the outside. So I thought it would be really useful to provide some suggestions on what we could do to support us moving into campuses. So one of the things that we could work on, or what I would suggest, is that outside agencies can be useful in working in advance with local education agencies to find supports. So campus administrators are essential to ensuring the streamline and the access of resources for all of our students. And so as Thresa recommended, when having a meeting in advance of the school year, sometimes the best time to do that is right around this time, a little bit in July, as they're planning for things and working on facilities and campus enrollment and scheduling classes. The student demographic needs are reflective of across the state. However, most families are Spanish dominant in South Texas, so it is essential that the supports offered to families ensure understanding. Some students live with guardians as their parents remain in Mexico, so understanding the challenge this poses for our students will create systemic structures to align to the process. One of my experiences was working in a high school that was 1 mile away from the border, so we did work with a lot of students that were under the care of a family friend, under the care of a friend, a family member, but not necessarily their parents. And so it was a challenge for us as campus administrators to find and align those supports to ensure that there's a streamline of supports for the student, especially when dealing with mental health. So some of the challenges we face in the area consists of access of resources. Sometimes we find that not a lot of the families are knowledgeable of the supports in the area. The same goes for educators. I think that sometimes, working now across the state, I've been able to see all the wonderful resources we have, but not every parent is familiar and every educator is familiar with what they can access or what the level of supports can actually be. And then the major challenge, especially in the rural area, was transportation for students and families to services. So a lot of the times the outside agencies would come into the schools, but sometimes parents were really reserved about that and didn't want to add an additional thing for the student to have to do in a school day, but they didn't have a way to get there. And so thinking about what are the resources that we could provide, especially in the rural areas, to, just share, that would be extremely beneficial. In all my experiences, families reach out to the campus for services. So in every experience I had a family come to me and explain that they didn't know what they could do or how to help a specific student. So they really did reach out to us for that point person. So really just sharing that knowledge and that information would really help the LEAs in that area. And some just for another challenge was some families were hesitant to receive services given their concern for needing to identify their home situation. So when I talk about this, I talk about students that may be living in a homeless area, or maybe parents and families are not living in the US. And so even if we saw a need for a student, some families were really hesitant to share that information in that area with any outside agency. So on the next slide, I provided for the audience the demographics for what the LEAs consist of across the state of Texas. So this is taken off of our TAPR, which is a state report that we have access to that really breaks it down by regions and by state and then also locally. So South Texas consists of 97.2% Hispanic population, 85.5% economically disadvantaged, 36.2% English learner, 62.2% at risk, and then the program enrollment, 36.5% bilingual, and 8% special education. So in this area, there's a lot of diverse needs. As you can see, 97.2% Hispanic. South Texas is unique in that aspect where a lot of the individuals, whether educators, students, families, represent the same demographic ethnicity and are able to speak and communicate with families given our demographic makeup. So on the next slide, I wanted to present to the audience what a comprehensive framework looks like across the state of Texas. This would be called your multi-tiered systems of support. And so I wanted to provide two distinct examples of what we as campus administrators focus on and how we provide the support. So on the right side, you see your triangle model. So you have your 3 tiers. Your tier 1 would be your universal supports. What are you offering to students throughout the day? What are those specific things that you're doing for your entire student body population? And then your tier 2 area is, what are those some targeted supports that you're providing for specific students that may demonstrate some needs? And then your tier 3 is, what are those intensive supports that we know of? The one on the left gives you that whole student. So as campus administrators, we look at, our whole student and as far as how they're doing academically, how they're doing behaviorally, and then what does that social emotional learning look like? So multi-tiered systems of support is formerly known as RTI, grew from efforts to improve identification practices in special education. Simply put, it is a process of systemically documenting the performance of students as evidence of the need for additional services after making changes in classroom instruction. Multi-tiered systems of support promises to change the way schools support students with learning and behavior problems by systemically delivering a range of interventions based on demonstrated levels of need. And so truly looking at this pyramid, we find ourselves identifying what supports do the outside agencies provide and where do they fit best. And so knowing this as we walk into a school, as we walk into a district, if you can ask, what is your multi-tiered systems of support look like? What does your RTI framework look like? And how can I best embed myself to provide the supports needed for the students? I think it would go extremely long way in ensuring that there's that flow and systemic alignment across the agencies. And so for trauma-informed care, what I wanted to really emphasize here is trauma-informed care. Students have experienced trauma, they're across the state. So sometimes the LEAs in South Texas and other areas practice trauma-informed practices, but they don't necessarily call it trauma-informed care. So in South Texas, I like to say that that's kind of our embedded practice. If we see a student of need, if we know what those challenges are existing, then we automatically, for the most part, I can't speak for everyone, but for the most part, we have that embedded culture where we reach out for support. Those are called trauma-informed practices. And so, you know, one of my examples as a former campus administrator, I had several examples, unfortunately, of students that attempted suicide. And so what I began to incorporate for them was that immediate need of how am I going to provide the best level of care of issues that I may not necessarily be able to resolve, deep-seated issues, obviously. And so, you know, we had a great rapport with our mental health agency where we could call automatically because students were getting the services, but sometimes students went under the radar. And I think that goes for all agencies across, whether it's a campus, LEA. And so one example is a young girl who was really struggling on the day-to-day basis, trying to get her work completed. And so from one day to the next, I was notified that she was in the hospital because she had attempted suicide. So I went to visit her. I went to visit her mother, her aunt, reiterated some of the stresses and anxieties that she was facing and thinking of ways that we could provide the level of support at the campus level. So it's those situations where the student was actually in a hospital about 30 minutes away from her home. There wasn't a nearby hospital to provide that level of support and care. And so thinking about how that relationship could be, you know, improved in regards to if we see a student that may be struggling, what are some things that we can do as campus administrators to help, you know, facilitate those resources specifically in that area, I think would be great. And so there's challenges exist with the understanding of how trauma-informed care is practiced across agencies. So sharing these strategies with the leadership team in campuses or districts or supporting and training may assist LEAs maintain that consistency. So a lot of LEAs conduct training in the beginning of the year. They have specific calendars. So if you work with a specific district or specific area, all districts, most districts have their calendars and their professional development days already printed and available online. So if you're looking for, and that's usually in a 2-year increment. So if you're looking for an opportunity to go into a campus and say, you know, or a district wide where you want to reach out to educators, you know, I would highly recommend that you know, look at the resources that are available, speak to individuals that are in charge of creating professional development at the campus and the district level, and try to embed them into just maintaining that consistency. Because what I saw personally from my area was that the mental health agency had a great relationship with students and their families. And so for me, I just wanted to be able to see what they were doing to support the child. And I wanted to share that with the educators so that way they could help support them in the classroom. And so I think as we continue to evolve and we learn what those needs specifically are, because they will be unique to each area, that would be something really beneficial that maybe could be trained on or shared with. And so the last thing is, you know, the needs. So what do we need from other agencies, or what could LEAs need? Need support by articulating the information, right? So once again, going back to what are the things that you're seeing from that perspective that we could help incorporate in our day-to-day operations and really meet those tier 2 and tier 3 supports for our specific students. And so, you know, sometimes the information is governed by HIPAA or FERPA. And so we have to be really careful with that. But as we maintain that level of communication, I think it's going to be the most beneficial for students, and we can leverage those specific tools. So some of the collaborative efforts that I experienced in the area in South Texas, my experience can attest to the direct services given to LEAs. So mental health services were in existence for students that access the information. So having a meeting with a campus designee can help maintain the information. So here I recommend that as we move forward, and as you know, my previous experience goes, that we really identify for those intensive supports for those specific students that need that tier 3 support, what it is once again, that we can do to help, get that information going. Lots of times I could attest to this. My parents would communicate with other parents. And so sometimes it was a positive, and sometimes it was like, just go here and they'll help you. But they didn't know what the number was. Some of them weren't comfortable accessing the internet. And so even as much as giving a number for LEAs to access and reach out for campus administrators, campus counselors, nurses, once again, those will be really beneficial to us increasing those collaborative efforts. And then, so one of my experience, actually, we were invited as a special services administrator, because I do work in the area of special education, was to provide a training for the mental health agency. So we went, prepared a training that demonstrated what an ARD consisted of. What were those relationships like? How could we help improve the services for students? And so really there we focused on building those collaborative efforts with the outside agencies and campuses and districts to ensure that we were all on the same page when it came to supporting the students. So those are one of the things. Obviously, the visibility of supports in the campus and the district fairs. My nurses were great at designing and facilitating campus and district fairs across the LEA. And so the mental health agency were invited and attended. And I think that was an awesome opportunity to get those resources available for our students and families. And so sometimes we made connections that not necessarily were for a specific student, but maybe it was a family friend or things of that nature. So those would be really great to partner with LEAs across the state. And then as well as integrating into the multi-tiered systems of support. We really want to ensure that those intensive supports and those targeted supports are being integrated at some level. And so assimilating into the school community, one of the things that I really wanted to point out was that districts and campuses work on district and campus improvement plans yearly. So these district and campus improvement plans identify the areas and targeted that the LEAs need to work on or want to target to help increase their students, whether it's their academics, behavior, or social emotional learning. And so as we know, in behavior impacts academics so much. And so that's an element I think that we could really find out locally their district improvement plan and what they're focusing on, and see how we can leverage our resources in that regards. And then understanding that when providing services, that some students are hesitant to participate given their desire to want to fit in. As a former campus principal at the high school level, that was one of our major things, was when students were pulled out, it was difficult for them. They did show a hesitation. And so they didn't want to be singled out because they needed a specific support. So sometimes what I recommend is if this decision is made in advance, either with the campus or with the family, that you take into consideration the student voice. So that's really important when providing those services and assimilating, because sometimes the students will get pulled out of their favorite elective. And so that's probably one of the things that keeps them coming every day to school. So thinking really strategically about when are the best times to work with students would be best. And then also in regards to that, just checking in and touching base with stakeholders in the district to ensure that it's meeting the needs of the students. So, if you have a good rapport with this guidance counselor or even the families, right, that you ask how the time is working, how we're doing going into the school, or what other things could we do to help facilitate this process, that would be my recommendation. And so my last slide is just kind of a very, very brief talking about the Texas monitoring and technical assistance. So as you heard, our charge this year was to redesign the special education monitoring program. So we will begin conducting monitoring for special education across the state. And so part of our plan is to really facilitate and identify areas. So as you saw, I'm one of the managers for review and support. So part of it is to align the supports that we can give for students across the state of Texas. And so as we're identifying areas of compliance or need, or an LEA really wants us to build build up what they need to focus on. We really are embedding connections to technical assistance. And so I would highly encourage you locally to work with, it could be obviously your educational service centers if you have a good rapport with them, could be with the district in general, and see where those connections lie when it comes to identifying what we could do to support our students in special education and how we can help students meet those needs, and obviously campuses, and kind of reduce that duplication of effort sometimes that I feel we have. And so I think if I could just really provide the audience with understanding that, you know, we're in this to really just meet those overall needs and continue to move our work forward and continue to improve the success of our students.
Okay, thank you so much to both of our speakers for those great presentations. So I'm going to unmute all of our audience members. So if you have a question, please ask one. If you don't have an immediate question, please remute yourself. You can find your microphone at the bottom left corner of your screen usually. That way we won't hear any background noise. And if you're on a phone, if you could please mute your phone unless you have a question. Any questions? Dr. Magallanez, I have a question for you.
Okay.
You had mentioned possible overlap in services that were provided to students with disabilities and the services that could be offered by the local mental health authorities. What's an example of a duplication of efforts that you would want to avoid?
So that's going maybe into specific examples. One of the things that I think we really want to avoid is, for example, if a student is receiving counseling, special education counseling locally within their individualized education program, then what are the objectives based on the student needs that special education counseling is trying to achieve? And then if the individual or representative from the local mental health authority is coming in, are they trying to duplicate and make sure that they're aligning what they're saying in order to continue to move the work forward for the student? So that could be one of the examples that I've seen across is, you know, and sometimes that's articulated by the student given their age. They'll say like, well, ma'am, I'm going over this, but then I'm going over that with them. So it, you know, it's hard for me to differentiate what's that priority and what do I need to do to move forward.
Mm-hmm. That makes sense. So that's a clear example of why there needs to be some really good communication, right, between the two groups. Yeah. Thank you. Does anybody have any other questions? Okay, well, I want to thank both of our speakers today so much, Thresa Caldwell and Denise Magallanez. Thank you for being with us and for contributing to this wonderful webinar.